Newlove-Delgado from the University of Exeter. And Tamsin is going to be talking to us about the impact on young people's mental health from school closures. Is Tamsin with us?
Yes, I am. Hi, James. I'm just going to share my screen. Hopefully you can hear me okay.
Yeah, all good.
I'm in a slightly echoey room, unfortunately. So I have to find somewhere to come and do the presentation. So let me just put this in full screen. Okay, all right. Is that showing okay for you?
That's perfect.
Lovely.
You're very clear, so don't worry.
All right, I'll kick off then. So thank you for inviting me to speak today at this seminar. So I'm Tamsin Newlove-Delgado. I'm a senior clinical lecturer and an honorary consultant in public health medicine, and I work with the Children and Young People's Mental Health Collaboration here at the University of Exeter. But in particular, I've been involved for the last few years with the mental health of children and young people surveys, which are run by NHS Digital. So I'm partially going to be talking particularly about the findings of those surveys today. So what I suppose I'm trying to address with this talk, and in terms of the agenda, sorry, just moved on a bit quickly there, is around the other impacts of COVID-19 transmission and control measures in schools. So I think I just heard the end of the last presentation around impacts on learning loss, so I'm going to talk around impacts on mental health. And obviously we need to understand this to try and develop policy which balances risks and benefits, and so that we can target support and medications accordingly. And I think, as we've seen, these kind of public health decision making that's been happening over the last couple of years is hugely complex and difficult, and really requires all these factors to be considered and to be based on the best available evidence that we have. So what I'm going to talk to you about today is an overall summary, really, of what we know about the impact of COVID-19 on children and young people's mental health. And I'm going to try and draw out what we might know about the impact of transmission and control measures in schools on children and young people's mental health, although there's less that specifically studies that topic. So I'm going to talk a bit about changes over time at population level in England using the national surveys data, give you a bit of an overview of the wider evidence of the impact of COVID-19, talk a little bit about what we know about schools, and finish with some implications for schools and some personal reflections. So I'd add this is very much a brief overview of a really large and complex topic, but I hope that it will add to some of the debates you're having today. So to start with, I thought I'd kick off with the findings from the national surveys, and initially for some context to how the mental health of children and young people has changed over time. And the data that I'm going to be talking about is from the mental health of children and young people in England surveys. These provide England's official statistics into child mental health. We had previous surveys in 1999, 2004, and also in 2017. And these were cross-sectional surveys which had 3-year follow-ups. So I suppose the big strength of these is that they use probability samples, and so are designed to be as representative as possible of the population. So that's in contrast to a lot of the convenience sample research that was done early on in the pandemic. And also that the samples, the surveys do use validated instruments of diagnoses and of mental health, such as the Development and Wellbeing Assessment and the Strengths and Difficulties Questionnaire. So this is just a picture of children and young people's mental health pre-COVID. So what I'm presenting here are the findings from the 1999, 2004 and 2017 survey. And what these are showing is population prevalence of children who would have a diagnosable mental health problem, or who would meet diagnostic criteria when we used a standardized diagnostic assessment. And as you can see from the top line, this had already been slowly but steadily rising since 1999, but appeared to be primarily driven by an increase in the prevalence of emotional problems, such as anxiety and depression. And you can see that as indicated by the red line in the middle. So there were already concerns about children and young people's mental health prior to COVID-19. And of course, when we went down into lockdown in March 2020, these concerns really intensified. So as I said, initially as a research community, we produced a lot of convenience studies to start with to try and take snapshots of what was going on. But at the same time, we were in fact already in progress in terms of planning the follow-up wave to the Mental Health of Children and Young People 2017 survey. So we were able to get that into the field in August 2020, which was wave 1 of follow-up. And this was followed by a further follow-up wave of the national survey in February, March 2021, which, as we remember, is probably, I think, during the second lockdown, although technically speaking, there was another restriction in the middle. And interestingly enough, we're now currently carrying out wave 3 of the survey that's currently in the field. And I might mention that at the end. So when I say we, I ought to give credit where this is due. I'm talking about the findings from these surveys, but these were funded by the Department for Health and Social Care. The 2021 also had funding from UKRI. NHS Digital commissions them, and there's a whole range of organisations that are really central to their delivery, in particular NatSen and the Office for National Statistics. Myself at the University of Exeter and Professor Tamsin at Cambridge have been involved as academic advisors, and so it's in that capacity that I'm speaking today. So in terms of the survey methodology, this can all be found in more detail in the survey reports. The 2017 survey included 2 to 19-year-olds. These at follow-up in 2020 were aged 5 to 22, and at follow-up in 2021, they were 6 to 23. The response rate in 2020 was 45%, and it was 48% in 2021. And also to emphasise here that the main measure of mental health that's being used in these follow-up surveys is the Strengths and Difficulties questionnaire. So this is a broad validated measure, and it has an algorithm which can be used to generate probable disorder. So we are able to categorise young people into those that probably would meet criteria for a mental health disorder, those that possibly might, and those that were unlikely to. And I'm aware that there are some concerns around the language of disorder. I'm just using the word disorder because it's what we've historically used in the survey reports, and it's a helpful shorthand. So that's the methodology of what I'm about to present. So these were our findings from when you compare 2017, 2020 and 2021, and this is a cross-sectional comparison. Again, these slides can be found in the survey report, and I'll share the resource at the end of this presentation. But what we can quite clearly see is this quite striking rise in the prevalence of disorder between 2017 and 2020 across all of these groups, 6 to 16-year-olds, 17 to 19-year-olds, with the exception being young men aged 17 to 19, where the increase was not statistically significant. And what's particularly interesting is that I think we had imagined that the 2021 survey might see a significant, I shouldn't say significant, we expected we might see a decrease in the proportion of those with a disorder following the, I suppose, the initial shock of 2020, but that wasn't the case. What we have seen here is that these high levels of disorder were maintained between 2020 and 2021, which makes it particularly interesting to see what we will find in the 2022 survey, which is currently in the field. And again, we might pick up on that in the end. And just to put these in context, perhaps, these are some of the slides used when we presented the report in the autumn. That in 2017, we saw 1 in 9 of those aged 6 to 16 with a probable disorder, and in 2020, this had risen to 1 in 6. So that's changing from around 5 children in a class of 30 to around, from around 3 in a class of 30 to around 5. So it's really quite significant in terms of need. So just moving on a little bit, but we included a number of questions around the education context in the surveys, in the questionnaires. And one of the things we asked about was change in level of support due to the pandemic. And we asked this to the parents of children with SEND. And we reported that just under half of these parents said that their child had had a reduction in the level of support that they received due to the pandemic. And this is a slide about school absence. So obviously in 2020, there was a lot of school absence due to things like self-isolation, bubbles breaking, illness, etc. And overall, around 1 in 10 children appear to have missed 15 or more days during that term. But what was striking when we looked at this by mental health of our participants is that those with a probable disorder were much more likely to miss 15 or more days of school in that autumn term than those who were unlikely to have a disorder. So we see this association between this absence during COVID and probability of a mental health problem. And finally, this is a suite of questions that we asked around resources to be able to work at home or to work virtually. So one of the things we again saw here, looking at this by disorder, is that those with a probable mental health problem were much less likely to have time to complete home learning, to be motivated to learn from home, to have help with studies, to have access to resources, to report that they were getting support from school or college. So obviously the national surveys are not the only source of data around the impact on mental health out there. There is actually a huge volume of research being done on this, and it's actually quite a mammoth task to attempt to meaningfully synthesize this and to tell you in this presentation what the impact has been. And I put up here this quote from, I think, a team in Canada who were conducting a living systematic review, that the rapid pace, high volume and limited quality of mental health evidence being generated does pose a barrier to effective decision making, which is obviously one of the things that we really want to try and inform. And a couple of examples of this here. So this slide that I have put up is from Samuele Cortese and colleagues, where they performed a systematic mapping of outputs on children and young people's mental health and COVID-19, and came up with more than 3,500 publications of different types that they mapped across different domains of mental health. But I also wanted to draw on at this point the evidence from our systematic review that we've been working on between Exeter and the University of Cambridge and Tamsin Ford's team. And this has been a systematic review of the impacts on children and young people globally. So it's been a global review. We haven't restricted it by geography. We had screened nearly 5,000 records, but found only 50 that met our inclusion criteria. So including children aged 0 to 18, using validated mental health measures, showing pre-pandemic to during pandemic change, and using population samples or education settings. So what did we find? So this review is currently in completion and in submission. What we saw was some evidence of improvement from pre to during pandemic in terms of some elements, such as perhaps in conduct problems or problems with peer relationships, and maybe in dimensions such as social anxiety, which is understandable. But obviously some of these observations of peer relationships and behaviours whilst children are living under restrictions is potentially problematic, because maybe they're not having the chance to have those interactions with other children. There's also been a lot of discussion and interest in which groups might have been more vulnerable to a deterioration in their mental health. And this was a particularly interesting finding by Wright et al., who used, I've totally gone blank as to the study that this was. If anyone's interested, please do email me and I'll give you the reference. But they found an indication of greater deterioration amongst children who, interestingly, hadn't had prior mental health difficulties. So almost a levelling down effect in their study. And some of the other studies we reviewed suggested that children that were younger might be more likely to experience more difficulties during the pandemic. So there's a lot we could say about this, but to summarise, the evidence does support a deterioration in children and young people's mental health, and we have also seen this accompanying rise in referrals and demand across the sector, although there are many ifs, ands and buts. So moving on to think a little bit about the implications for schools of this body of research. So there is actually relatively little research, as far as I'm aware of, that has addressed the impact of school-based measures specifically on mental health. And by that I mean measures that we might use to control transmission in schools, such as ventilation, masks, testing policies, bubbles, isolation, all these kind of measures. So very few studies, as far as I know, have attempted to address the impact of these measures on mental health. Obviously, there are many studies which have attempted to link much wider and broader measures such as school closures with the deterioration of mental health. And there are obviously studies which have looked at the impact of masks in very young children in terms of impact on development, which I won't go into here. There is, however, some qualitative research on children and young people's experience of some of the measures being used in schools. So, for example, there was an interesting study suggesting that children who were moving from primary to secondary during the pandemic found there to be some benefits from bubbles, but I think this was more around the ability to make and keep friends in a smaller group, and this was only if they were used flexibly, but it's an interesting perspective. And we ourselves have been doing some qualitative research on the experiences of children and young people returning to education, and the findings there are that some young people found the negotiation of rules and routines on return to school could be anxiety provoking. So, you know, should I be wearing a mask? Should I be in this place? Am I getting things right? Am I getting things wrong? Whereas perhaps other children found these things might have given them a sense of safety. And I obviously move on to the point that all researchers love to make, which is that more research is needed. So firstly, I want to pick up on the issue of future trends. So I mentioned at the start that we have seen this increase cross-sectionally at a population level in the prevalence of problems that was maintained between 2020 and 2021. I guess what we need to see now is how this pans out into the future and whether this increase is maintained or whether we see a slow decrease. And also who experiences these increases and decreases. And that's the point about population level change masking individual trajectories. So this was looked at in a relatively crude way, I suppose, within the surveys where the team did look at individual level change between 2017 and 2020, so in individual children and young people. And here, hopefully you can see the slide on the right. It's rather more mixed. So a proportion experienced deterioration over time, another proportion remained stable, and a smaller proportion of children experienced improved mental health between 2017 and 2021. And that leads me on to my point about, whilst it's really important to continue gathering high quality population level data over the medium to long term, we also have to think about studies addressing impacts on more disadvantaged or marginalised groups. And I think there is the potential for more sophisticated quantitative research or modelling that can examine the links between some of these measures and restriction levels and children and young people's mental health. So, for example, in our systematic review, we've tried to capture data on the level of restriction stringency or what was going on during that country at that time, but there's a whole lot of data to disentangle, and the relationships and timings of data collection are really complicated. I also think that more qualitative research on the experiences of different public health measures used in schools would also be valuable. And there's something here also about understanding what worked for some children and young people. So how can we keep any silver linings? So a number of studies have found things such as children saying they felt that lockdown was a welcome respite for them. That might be to do with children who were struggling to engage with school or who had anxieties or maybe were being bullied. There were others that felt that learning during the pandemic was more flexible for them, or they experienced a reduction of some pressures, or that the possibility to engage virtually was more inclusive for them. So there is something about understanding that things were better for some children and young people, and how perhaps now having to re-engage with the school environment can be really stressful for them. So what can we do in terms of supporting recovery, thinking about mental health in schools? There's obviously a lot of good evidence we can already build on to take action. I think one of the things that is really interesting is things like whole school approaches to student engagement, student-teacher relationships and peer relationships. So interventions that aren't just targeted at individual aspects within schools, but which are about the feeling of community and engagement that there are for children and young people, particularly after the pandemic. But of course, there's a whole wider problem around improving access to specialist services for those that need them, and also mitigating this impact that there has been on wider social and economic structures. And that's particularly important around supporting those who are entering education and employment and improving their opportunities. And finally, I have just added some personal reflections around prioritising children and young people in future responses. And these are around the fact that children and young people are different from adults in being moving targets, in the sense of experiencing really critical and sensitive periods in their development. And obviously development continues throughout the lifespan, but there is something particularly crucial about these periods during childhood. And therefore the needs of children and young people in the round should be explicitly considered and form part of all risk and benefit assessments when we think about measures that we might be using. At the same time, high levels of infection and consequent societal impacts also affect children's mental health, because children are part of families and part of wider society. So there's a lot here to balance. But protections in future obviously need to be carefully targeted and regularly reviewed. And I think I also wanted to add that there's something about maintaining momentum here. So media focus might move on and has moved on from the impact on children and young people's mental health, perhaps, but we as a society can't really afford to do that. The foundation for lifetime mental health and well-being is laid in childhood. So I'm just going to say, I'll thank you and pause for questions. I wanted to say that I'm also happy to be contacted by email about any of this. I've got some funding and acknowledgements up here and some resources and references. I'm aware this is very high level, quite fast, and very much a summary. Might not have been what you were looking for. I'll stop and see if I can answer any of your questions.